Hi everybody, and welcome back to Morgellons discussion and microscopy videos. I'm your host Jeremy Murphy, and today... Hi everyone, I recently watched Brian Kirk's inspiring video about his college project to raise awareness for Morgellons patients, and I wanted to take a moment to share some thoughts. First off, huge kudos to Brian for shining a light on this often misunderstood condition. Morgellons can be incredibly challenging for those affected, and projects like his help give patients a voice. Today, I'd like to build on his work by sharing some key information about Morgellons, especially its connection to Lyme disease, and how doctors can better identify it or rule it out in patients. Brian's project is a fantastic step towards helping people understand Morgellons, a condition where patients experience skin lesions with unusual fibers, along with symptoms like fatigue, joint pain, and sometimes a crawling sensation. His focus on patient stories reminds us how important it is to listen and advocate for those who feel dismissed by the medical system. I noticed his video didn't mention Lyme disease, which is a critical piece of the Morgellons puzzle for many researchers and patients. So let's dive into why that matters. Morgellons has been controversial, with some doctors labeling it a psychological condition like delusional parasitosis, but recent studies tell a different story. Research like a 2015 study published in BMC Dermatology found that Morgellons is strongly associated with Lyme disease, caused by the bacteria Borrelia burgdorferi, which is transmitted by ticks. In that study, 24 out of 25 Morgellons patients tested positive for Borrelia in their skin, blood, or other tissues. This suggests that Morgellons may be a physical illness triggered by an infection, not just a mental health issue. Why does this matter? Lyme disease can cause a range of symptoms: fatigue, joint pain, neurologic issues that overlap with Morgellons. For many patients, Morgellons seems to be a specific way Lyme manifests, with those unique fibers made of keratin and collagen produced by the body in response to the infection. Not everyone with Lyme disease develops Morgellons. About only 6% do, according to some estimates, but the link is strong enough that anyone with Morgellons symptoms should be tested for Lyme and other tick-borne infections. Raising awareness about this connection can help patients get proper testing and treatment like antibiotics, which have helped some Morgellons patients improve. So how do doctors figure out if someone has Morgellons or something else? It's tricky because the symptoms can overlap with other conditions, but here's the process in a nutshell. First, a doctor should do a thorough physical examination looking for those hallmark fibers in skin lesions. These aren't textile fibers like lint, they're biological, often confirmed by microscopy to be keratin or collagen. Next, test for Lyme disease using sensitive methods like PCR or antibody tests from specialized labs. A negative Lyme test doesn't fully rule out Morgellons, but it's a key step since the conditions are so closely linked. Other conditions to check include skin infections, allergies, or even rare disorders like cutaneous amyloidosis. A doctor can help analyze skin samples to confirm the fiber's origin. Mental health should also be considered, not because Morgellons is all in the patient's head, but because chronic illness can cause stress or anxiety, and some patients may have conditions like delusional parasitosis where no fibers are present. A compassionate evaluation ensures nothing is missed. By systematically ruling out other causes, doctors can better confirm Morgellons and avoid misdiagnosis, which is critical for getting patients the right care. Brian's project is a powerful reminder that awareness starts with us, patients, advocates, and researchers working together. If you or someone you know has Morgellons symptoms, don't give up. Seek out a Lyme-literate doctor, get tested for tick-borne infections, and connect with groups like Real Morgellons on Reddit or Morgellons and Lyme Awareness on Facebook. Let's keep the conversation going. Share this video, check out Brian's project, and let's advocate for better understanding and treatment for Morgellons patients. Thanks for watching, and a big thank you for Brian for inspiring this discussion. Together, we can make a difference.